Well, you know the health care reform package got through the House, but it is facing stiff winds in the Senate, and that's not the only place. Critics within the health care industry are now upping their opposition to the bill as well, the Republican bill to replace Obamacare. The New York Times, in fact, is calling it a rare unifying moment. They say a number of doctors, hospitals, and insurers are going to be pushing for major changes. Dr. Mark Siegel is a professor of medicine at NYU Langone Medical Center, and by the way, has his own piece going up in the New York Times as well. Good to see you today.
Great to see you.
Okay, so it made it through the House, but a lot of breaks going on in the Senate. What do you think will have to change for this to move forward?
I think there's opportunity for compromise here, and I think certain things can change that will make it much more likely for this to pass. For example, the MacArthur Amendment set up a situation where states could cut down on essential benefits, so-called essential benefits, because some of us don't think they're all essential. I think emergency room visits are essential. I think vaccines and epidemics are essential. Opioid is essential, addiction coverage, but some things aren't. So states with the MacArthur Amendment could say, we don't want all of that, we want less of that. And pre-existing conditions, if we have high-risk pools set up, and people lapse in their coverage, they could get their insurance through a high-risk pool. But Shannon, critics say those high-risk pools, though they've worked in the past, have always been underfunded. So let's not underfund them. Let's not underfund them. President Trump says $8 billion. The bill right now says $8 billion. I'm telling you that's not enough. So one compromise could be if you create high-risk pools for those with pre-existing conditions that aren't getting it through the regular insurance, fund it, and that's where subsidies belong. Okay,
and one of the critics, and a number of insurers have been very careful to kind of stay on the sidelines with their criticism, although other groups have come forward. But we're hearing now from the CEO of Blue Shield of California. He says, we feel compelled to oppose this because it raises the specter that the sickest and neediest among us will be disproportionately hit in losing access. And that's been the complaint all along, that even if you have insurance, that doesn't necessarily equate access under Obamacare either.
That's such a great point. I'll tell you as a practicing physician, what is insurance? It's a gatekeeper. It tells me you can't give that. Hey, doc, you better get a pre-approval. Hey, doc, I'm turning that down. Hey, doc, I ain't paying you for that. So insurance is in the way of giving health care a lot of the time. So more insurance doesn't necessarily mean that my patient's going to get better taken care of. On the other hand, this also may be referring to the Medicaid expansion, which I want to go on record right now again and say I want that kept. I think there's much more of a chance of this getting through the Senate if they cut that out of the bill, especially with the current Medicaid czar, Seema Verma, who was wonderful at creating Bridge to Jobs programs, which she put in Indiana, having premium buy-ins for anything more bells and whistles on Medicaid. I'd like to see the Medicaid expansions kept. That's something that we could offer the Democrats, that the Republicans in the Senate could offer the Democrats and say, hey, we're going to put more funding in the high-risk pools. Hey, we're going to keep the Medicaid expansion, then it has more of a chance of passing.
I mean, I know you're busy here saving lives in New York, but maybe we have to send you to the Hill. You could be a negotiator on this.
I'm ready to go. Listen, President Trump, I'm ready to go.
He stands ready in service. All right, doctor, thank you very much.